Hi guys, I'm Noreen with AesthetiCare, and I've got the fabulous Angie here, and we are going to be doing a dermal filler treatment on Angie. So Angie has had filler before, but we are going to just enhance a couple things. So Angie, go ahead and sit up for me just a bit. And so Angie is starting to kind of flatten out here on that lateral cheek. So if you look at the cheek and jawline projection, it's pretty similar. So what we want to do is give her a little bit more volume through this lateral cheek, lift the cheek up, which will help slim the lower part of her face. So Angie told me that she really doesn't like this area. So this, we call it the jowl. And so what happens to the face as we age, these superficial fat pads start to migrate down and causing heaviness in the lower face. And then we start to flatten up here in the lateral cheek. So our goal today is to really pick up this lateral cheek to make the jowl look a little bit slimmer. The other thing we're going to do is we're going to do a little bit back here at the end of the mandible to pull that jowl back as well. We're going to soften here in this little sulcus between the jowl where you get this little dip or almost this little hollow here, this pre-jowl sulcus. The other thing that kind of bothers Angie is these lines here. She's very, very expressive. So, especially on this side, when she makes that face she just made, she starts to see this little creping here. So I'm going to come back in with a softer filler, softer hyaluronic acid filler, and just soften some of this here. So it'll be very, very natural progression from the cheekbone to the mandible. Lastly, we're going to hit just a little bit in her lips. She's got beautiful lips already, but we're just going to give her a little bit more volume and just even her out where she's got a little bit of asymmetry on that top lip. We are going to do a smidge in her chin as well to pull her chin forward. So when you look at her from the side, she's pretty flat through the chin. When we pull this chin forward, it's also going to help with the jowling that she doesn't like. So we're going to start with her cheeks with a little bit of Juvederm Voluma, and that's going to be a filler that really sits on the bone and almost acts like an implant to give nice lifting. She's had filler before and she's been numbed and cleaned, so her skin, I've used HIPAA cleanse and she's completely clean, so we'll get started. Angie, do you have any questions before we get going?
I'm good. Ready.
All right.
Excited.
All right, my dear. So it's going to be a couple little pokes on each side. Nothing too painful. So the first time I injected Angie, she was very, very nervous. She loved the results so much that she decided she wants to come back for more. All right, my dear. I'm going to do a little tiny poke, and I'm going to pull that tissue up to really almost act like a tack in the skin. A little tiny pinch here. So I'm sitting right on the periosteum. Aspirate just to make sure we're safe and we're not in the way of any vessels. And you might feel just a little bit of pressure here. So the filler that I'm using, which is Juvederm Voluma, lasts up to about 2 years. Now, depending on the person's metabolism, some people get more longevity than others. It really just depends on the individual. What I tell people is don't let it all go away. So once you've had your first treatment, you want to stack product on top of it so it doesn't all go away, so you're not starting from ground zero every time. So typically, treatments after the first, you use much less filler than that first treatment. So we're already starting to get that nice lift. One more little poke here, dear. Angie's got a little scar here, so sometimes going through scar tissue is tender, but she's doing a really good job. So the point I'm at right now is the malar eminence. So this should be the most projected part on the cheekbone. So we want a nice lift in this area. All right, turn this way, dear. So you can kind of already start to see this lift through the jawline as well. A couple more little pokes right here, my dear. So on a 0 to 10 scale, what would you say your pain is, dear?
Probably a 2.
So yeah, so very, very manageable. And Angie doesn't like needles, so for her to say that, that's a pretty big deal. So Juvederm Voluma is hyaluronic acid. Hyaluronic acid is it's a polysaccharide, and so it's basically a sugar compound, and it is cross-linked to designed to give lift to the tissue. So it's 99% of what the own hyaluronic acid that we make in our body is. So it's kind of like we're replacing what we've lost over the years. So we are almost done with this side, my dear. Last pinch right here. So filler in the cheek, it shouldn't be that it makes your cheeks look fuller. It should actually slim the face. So that's one of the main things I hear with filler is, I don't want filler in my cheeks. It's going to make my face rounder, and I already have round cheeks, and I hate my jowls. Well, it's actually opposite of what you would think. So when you put filler in the cheek, it actually slims the face when you give lateral projection. So sit up for us. So you can kind of see, bring your chin down just a bit. So you can kind of see now she has more of this nice defined cheek. As far on this side where she's a little bit flatter over here. So this side already looks a little bit slimmer. All right, my dear, go ahead and lean on back. So I'm gonna go ahead and continue on this side of her face. I'm gonna give her a little bit back here in the mandible where she's lost a little bit of bony prominence. So as we age, we don't only lose the fat pads or have them descend down, we also lose bony projection. So we'll all get a little bit of mandibular depression where it pulls in the jawline. And especially back here, we wanna give this angle back because it really pulls that tissue up. So we're going to put Restylane Define in her jawline. I really like Restylane Define because of the way it's cross-linked and the expression technology. So it moves with the person, which is why I love expression technology in places where you have a lot of motion. So it's very, very natural. All right, my dear, little tiny pinch. So I'm going to pull that tissue up, give her a little poke right here. So she can expect to have a little bit of tenderness in the area that we did the filler. That's very, very normal. That usually lasts a couple days. And one more little poke right here, dear. Turn this way. Perfect. All right. Okay, so now I'm going to do this little pre-gel sulcus here. I'm just going to give her a little bit of filler. So from her chin through the jowl and through the mandible, it's one nice even continuous line. So you're going to feel one little poke, and I'm just kind of right in here looking for her little vessels. Little pinch. Perfect. And now I'm going to move in the direction of her chin. So her chin is nice and angled, so it kind of comes down to a point, which is what we really want, very aesthetically pleasing and very feminine, but she's also pretty flat. So if I pull her chin forward, it will also help that jawline, having that straight line and that real nice angle to the jawline. So I'm going to give her a little bit here in her chin. Turn this way just a bit, my dear. And a little tiny pinch, dear. So in my opinion, chins are the most undertreated area on the face. So if you think about a very youthful face, it's kind of like a triangle. You've got the widest projection here on the lateral part of the cheek and the most narrow in the chin. So as we age, we start to square out through the chin, which is more of a masculine trait, and we start to angle. The angle here also starts to get more square. So if we bring this forward, it's just going to keep her nice and feminine through the shape of her face. Tiny pinch, dear. So most clients, when I tell them they need a chin, they look at me like I have 3 heads. And they don't really understand why until I give them a chin and what an impact it makes on the shape of the face. All right, so now I'm going to go to the other side of the face. We're just going to change a few things around and we'll be right back with you. Okay guys, now I'm on the other side of Angie's cheek. So I'm going to give her that lateral projection over here and kind of mimic the same thing I did on this side. All right, my dear, little tiny pinch. Turn this way, dear. Beautiful. Last little poke right here, and then we're done with your little cheeks. So now she's got some really pretty lateral projection. You can really see where that zygomatic bone is. So it'll be great when she goes to put her bronzer or blush on. She can follow that line, highlight on the top to really enhance that nice, beautiful cheek. All right, Angie, I'm going to come back here just on your jawline on this side, so you'll feel just a couple pokes. As we come back down to the jawline, I'm going to use Restylane Define. And remember, our goal is to pull the jowl back. So we've got a lift here through the cheek, which she's really got no laxity now from doing that cheek filler. Now I'm going to do the same thing back here. She's going to have the best jawline in town. All right, my dear, little tiny pinch. Perfect. Last little one right here, dear. So now I'm going to give a little bit of filler to Angie's lips. I'm going to be using Restylane Kiss, which is one of our newest lip fillers. It's a hyaluronic acid filler that is wonderful, has great tissue integration, and just gives a nice lip augmentation with a lot of time that it will last. So I'm going to be using a cannula. A cannula is a needleless needle. So I'm going to make one little port of entry on each side, and then I'm going to put the filler in through a needleless needle. So it helps with comfort, it helps with bruising, and it helps with swelling. So a lot of times I'll use a combination of cannulas and needles to enhance lips. So I'm going to start on her bottom lip here. All right, dear, just tiny little pinch. So I'm going to go through my little poke, and you're going to feel just some pressure. And you can watch the filler just lift and open that tissue. So the other thing we're trying to do, we're trying to help with these little fine lines on our lips. You know, we get wrinkles on our face. We also get wrinkles on our lips as we age. So you can see just popping that little bit out helps with those little fine lines. Now we'll do a little bit on her top lip. All right, dear, little tiny pinch. Worst part. And as you can see, Angie's got a great pain tolerance. As she giggles about that. Little tiny pinch. And just that little bit really popped up that upper lip to kind of make it look like the other side. So now I'm going to use a needle just to give her some definition in that upper lip. All right, my dear, you're gonna feel a little pinch. Worst part. So you can just see that real pretty shape there. All right, and now I'm going to go to the other side. Okay, so now we're going to do the other side of Angie's lower lip. So you can see how smooth this side looks and how she's got all these little fine lines over here. So I'm just going to soften these little rhytids on this side, and you're going to feel a little tiny pinch. So what Angie can expect tomorrow, like I said, she'll be a little bit tender. The other thing, lips always tend to swell. So she's going to have more swelling on her lips than on any other part of her face that we've injected today. So I like for the patient to stay out of the heat, to ice on and off, 20 minutes on, 20 minutes off, as she can today. She can take a Benadryl before bed. She can use Arnica montana. Arnica montana is an herbal supplement for bruising and swelling. It is the enzyme that is in pineapple. So if you eat fresh pineapple, it's got bromelain, which is an enzyme that helps with bruising and swelling also. So those are some of the things she can do to really help with the bruising and swelling. So when you are booking for lip injections, you want to make sure you don't have a big event. You want to make sure you don't have a wedding or a special occasion within about a week or two, because your risk for swelling and bruising is pretty high with the lips, more so than anywhere else on the face. And a little tiny pinch here, dear. Pinch. So I can travel the whole length of one half of the lip and add the filler without making multiple injections into the body of the lip, which really helps with swelling and bruising. Not that you couldn't still bruise, but just your risk is pretty substantially lowered. All right, let me just enhance your little borders here, dear. I am all for very, very natural lips. You don't want to look like they've been done. We don't want to see any big Kardashian lips. It should be very natural, and it should be the exact same shape as your own lip. So, you know, when people come in and bring me pictures of other people's lips they want, many times that's unachievable, because you want to really keep the integrity of the own shape of your lip, because it looks more natural. And this is a little tiny pinch one, dear. Very nice. So then I'll kind of look for symmetry. I'm going to have you turn towards me, dear, and pucker for me and smile big. Perfect. She looks very, very symmetrical. Go ahead and relax your smile. So I'm going to put just a couple in for these little wrinkles. I'm very happy with the shape. I'm happy with the amount of projection, but I'm just going to try to pop out just a couple of these little tiny wrinkles in her lips. So you're going to feel a little pinch. The other thing is, you can tell, you can see it right before your eyes. See how much her lips have pinked up just from putting the product in there? When she comes back for her 2-week follow-up pictures, you're going to notice that she's got a lot more pink to her lips, which is really one of the things that make it really beautiful when she comes back in. Because as we get older, the pink to our lips starts to go away. So it's kind of like you're just pinking them back up like they were when you were younger. All right, now have you turn forward. So very pretty, very subtle. Just a little bit of minimal bruising there. What would you say on the lips? What would you say your pain level was?
5.
5. So a little bit more painful. We have a lot more nerve endings in our lips and around our mouth than we do on any other part of the face, which is why people like to kiss. So that just goes to show they're doable, but they do hurt a little bit more. Some of the things we have here at AesthetiCare that can help with that is Pronox, which is a nitrous oxide that really helps with the pain. So that would have been something that is offered. And I did offer it to her, and we kind of talked about that, and she thought she'd be fine. The other thing is we put a very strong numbing agent on the skin, so she had the numbing on for about 45 minutes before we started the procedure. So those are things. The other thing we could use was ice, which she'll use today to help with the swelling. It'll also help with any pain that she's got after. But those are all offered here at AesthetiCare to make your treatments as painless as possible. So I've completed Angie's transformation today. I did a syringe of Juvederm Voluma in each cheek, some Restylane Define in the jawline, pre-gel sulcus and chin, and Restylane Kiss in her lips. She had a beautiful result today with 5 syringes. Are there any questions you have for me today, Angie?
I think the 2 things that I would like to know is how long this is going to last for all the products, and then what are my restrictions?
Sure, great question. So your main restrictions for today is staying out of the heat, also icing on and off. So if you could not work out and stay outside from when it's a real hot day for about 48 hours, that will really help with swelling and bruising. Also, when you get home today, if you can ice 20 minutes on the areas we treated and 20 minutes off, that's ideal, especially on the lips. The lips just swell the most out of any place on the face, so you really want to ice those areas. You could also take a Benadryl before bed that will help with swelling. Those are your main restrictions. The other thing you also want to do is keep your face clean. So no makeup for the rest of the day, no touching, wearing masks. So I really like for patients when they leave here to not have a mask on. We don't know what type of bacteria is under the mask, so really not to have that on your face. Those are your main things. We just want to prevent any infection that could happen if you're not doing the right thing after your treatments. So the other thing is how long they last. So most dermal fillers last up to a year. Juvederm Voluma has an indication for up to 2-year length of duration, and the rest of the fillers we use up to a year. In general, most of them last up to a year, but I really try to encourage people not to let all their filler go away, so we can just stack that filler on top. So next time if she comes in 8 to 10 months, we'll just do 1 or 2 syringes instead of 5 like we did today. That's where you really get the best results. So I really hope you enjoyed the treatment that we got to see today. If you have questions on dermal fillers, filler in the lips, cheeks, chin, anywhere on the face, please call us here at AesthetiCare and we can answer all of your questions. We have amazing nurses here that are qualified to treat you and really tailor your treatment to you and you only. Thanks so much for watching.